I'm Russ Altman, and today Professor Lisa Chamberlain gives us an update on the health of children in the United States. Compared to 100 years ago, we're doing really well with decreased mortality and many diseases pretty much eliminated. But in the last few years, before the pandemic even, there were some worrisome trends. And of course, during the pandemic, things have exploded in certain areas. But there are several bright spots that give us hope. It's the future of pediatric health. Well, the health of our children is critical for the future of everything. Obviously, children are vulnerable because they are still developing both physically and emotionally. And they can show great resilience in some settings and great vulnerability in others. Historically, children were subject to stress because of uneven access to food and for great risks from infectious disease, especially because of poor hygiene and bad sewage. They were also subject to child labor conditions and educational access that was uneven. It was rough being a child 150 years ago. All these things have a profound effect on the human population because those children become adults, and it determines what their life is like subsequently and what kind of diseases they experience. In the 20th century, we've made great strides in child health, and we've addressed many of those old problems of hunger and infectious diseases. But new problems have arisen. Challenges in obesity, challenges in mental health, and, of course, in 2020, the COVID epidemic. These problems impact children differently based on their social and economic resources. Well, Professor Lisa Chamberlain is a professor of pediatrics and a practicing pediatrician at Stanford University. Her research focuses on child health and its disparities and its outcomes. She also looks at public health and policy questions. She has studied the public health of children carefully over the last 20 years and describes unprecedented changes in the health of children during the COVID epidemic. First, Lisa will describe the amazing improvements in childhood health over the last 100 years. We are fortunate because we can expect our children routinely to outlive us. That was not previously the case. However, Lisa will also outline current challenges and impacts that the pandemic is having on both the rich and the poor.
Well, first, Russ, thanks so much for having me. Really have been looking forward to this conversation with you, knowing you and how you like to go widely. I would say it's the best of times and the worst of times. So let's talk about the best of times. I mean, obviously, when we have kids in America today, we expect to lead a long, healthy life, and parents expect to pass away before their children. This was not always the case. Mm-hmm. So if you look back 100 years, 200 years, we have seen remarkable gains in decreasing child mortality, child morbidity. So much has been great. A lot of that is both medicine and public health. We have clean water. We have clean milk, a clean milk supply for babies. This was a lot of the birth of pediatrics was around milk stations in New York City and thinking about, how can we make sure that, what we have is not contaminated. And then improve nutrition. As we are healthier and have increased nutrition, our immune systems are stronger and more able to fight off disease. So you move past all those great public health interventions to immunizations, antibiotics, kind of more the biomedical model. I think it's important to acknowledge both sides. So that's the best of times, right? We've arrived to a place where, we have mostly families that are food secure. We have, clean water. We have good sewage, these sorts of fundamental things that I think a lot of Americans take for granted. It's one of the beauties of traveling as you turn around and you see your own home differently. So I think that perspective that can come from going other places helps you appreciate how children in America are quite fortunate. Now, if I put on my hat as a public health pediatrician, a pediatrician who sees patients in our local community here adjacent to Palo Alto, I worked for 15 years in East Palo Alto as a pediatrician. Now I'm in Redwood City. Amazingly rich, diverse, strong communities, largely immigrant communities. I work in federally qualified health center setting, which is just a kind of community-based clinic. I speak Spanish most of the time. then I start to see the worst of times. Because what I have seen over the last 20 years is a widening income gap and widening disparities in terms of opportunities for our kids. And this was beautifully described in a book by Robert Putnam, Our Kids, and was a really important sociological perspective and thoughtfully written book about how the gap in opportunities between populations of kids who, let's just say, for those of you who are local, that live on the Palo Alto side of the 101 versus the East Palo Alto side of the 101.
So this is basically, for those who are not familiar, rich and poor.
Rich and poor, and I think any community you can think like East Side, West Side, or that they typically are neighborhoods that are historically segregated, separated either by a highway, by a river, the tracks, the other side of the tracks. That's where that expression comes from. That gap in opportunities for the children in those communities over the last 50 years has changed dramatically, and
these gaps have health manifestations.
Absolutely.
I'm sure that they have lifetime manifestations, but as a pediatrician, you're seeing this play out even in the health realm.
Absolutely. So let's talk about obesity. That's an easy one. When we think of the overall obesity rate for kids in California, it's 30%, 25-30%. But in the communities, low-income communities, it's closer to 50-60%. And in high-income communities, it's closer to 10-12%. So when you take the overall number, you lose the story. Right. We really have to push overall numbers and say, well, let's disaggregate that. Tell me what does that look like by socioeconomic status? Is it the same? 30, 30, 30? Okay. Right? Then I know I've got a condition that's not sensitive to context.
Right.
And when it's really different based on context, then whoa, what's going on here? Because we know it's not genetic. We know that what it is that it's rooted in not having the same access to healthy food. That a lot of people live in food deserts where there isn't healthy food options, where they are saturated with fast food restaurants. That's based on zoning. These are political decisions.
That's fascinating. So the location of the food places is a political decision.
Absolutely a political decision. When we think about green space, we know one of the ways to bring weight down is communities that have active green space with lights at night, where people can get out and run or walk or play soccer. A lot of our low-income communities don't have safe green spaces that are really truly available to the community, for a great portion of a 24-hour period. So when you have entire populations having different prevalence rates, different rates of these kinds of things, it's because there are forces going on in that community that are changing entire groups' behaviors because they don't have the same choices that other people have. So that's how it manifests in kids.
Yes.
Obesity rates that are different, asthma rates. Again, any of these conditions that have their roots in environment, in environmental context, and more, many of our conditions do. And so that's where we start to see child health disparities.
So again, just for setting the table, and I know this is going to be a complex answer to my simple question, but could you give a summary of how do we make these measurements? How do we even know? Because there's a famous saying, you can't intervene until you can measure, and you've quoted some really worrisome statistics about obesity, and you've made reference to asthma. How do we even know these realities, and is it reliable information, and is it good enough for people like you to start thinking about the policy implications?
Yeah, so for the examples of what we just talked about, I think the data sources are quite good. We have national data trends of weight that we've been following for years. This is CDC level data. And
is this individual pediatricians just sending it up to the county, or how do we do this?
Yeah, no, that's a good question. I believe that data comes from high schools that are screened. And we've actually hit a plateau in terms of weight gain and are starting to see things starting to come down because of public policy changes, getting vending machines out of schools, taxes on sugar sweetened beverages.
You've written a ton of interesting papers about fruit juice. I was very entertained in reviewing some of your work. It looks like there were some little letters to the editor back and forth forth. And
Oh yeah, that was a fun one.
so
Yeah, so the data is very good with that. Data on food insecurity is very good. Percent of kids living in poverty is
great.
very high resolution data because it's at the school district level. There are areas we could have better data. I feel like I'm not as confident about our data around mental health. That's harder to get. Teenage pregnancy is very hard actually. To get, although the Guttmacher Institute does a good job. So some of the metrics are easier, some are harder, but we do have some surveys, both California-based and nationally, that are fielded every year or every other year that are oversample different populations. And so depending on what you're interested in looking at, we can, the data varies, but there's a fair amount.
So that's really helpful. And so now let me get to actually the big question, something that I know you've been very concerned about. What did COVID, so you described this playing field, what did COVID do to all of this? And what are we seeing now?
So, wow, what a couple years it's been. Children, blessedly, physically were not as impacted as some other populations. So still, kids need to be vaccinated. Children are still medically at risk for COVID. So that is definitely, I want everyone to hear that. At the same time, this is not a disease that targeted the young the way, say, the 1918 Spanish flu did, which, I try to imagine going through the last 2 years with that kind of...
With children dying at that rate.
Right and left. It's been a hard couple of years. It could have been harder. Regardless, so kids are still at risk. They all still need to be vaccinated. There's no question. Where we are finding that this pandemic is taking a toll on children. And again, think of both sides of your highway. Think of the two different populations of children because it really did impact them differently. Is in the area of health. It's been mostly around mental health issues, which I can talk about, and then also in terms of educational impact. Very differential impacts for our different...
Yeah, let's go into these sound very important.
So with mental health, we know that children's and adolescent mental health was on a worrisome trajectory pre-COVID. So really interesting, important papers that were looking at increasing levels of anxiety, depression, complex ADHD, some OCD. We're not totally sure the etiology on that, what the roots of that were. Some people talk about the new role of social media.
Yeah.
There are some other complex things to think
Anyone
about.
who's met a teenager is very impressed with their lifestyle with the phone.
It's quite a deep relationship. And you and I and our generation, we will always be digital immigrants. They are digital natives. It's a different relationship that they have. Yeah. So I'm not totally, and I'm not an expert in that. Lots of really smart thinkers around here and other places about adolescent mental health. But we know we weren't on our way up. We were definitely struggling just to begin with. Then COVID comes and we've got families isolated. We've got kids suddenly isolated from a lot of important adults in their lives, away from their coaches, their teachers, their other people, other adults that may have been shoring up, difficult situations. And then they're in this situation where they're having to learn online. And so this has really caused a lot of increased isolation. We have seen an unbelievable increase in eating disorders, both in boys and in girls. We've seen increased depression, anxiety.
Is this on both sides of that so-called track that we were talking about before?
It is on both sides of the track. And where we are seeing it even more so with low-income families is that a lot of those children have lost family members. So that we know that there are about 170,000 children who are COVID orphans, who have lost their parents or a grandparent who was their primary parent. And so for that group, it's an even more impact because those adult deaths were not evenly distributed on both sides of the dividing line, right? And so we know our children who are growing up in lower income families are disproportionately bearing the grief of losing either a parent or an aunt or more than one aunt and uncle. Like they really can give you a list of all the people they know who have died.
Their entire life circumstance has been uprooted.
They've been to funerals and they, Zoom funerals. schools. And when we talk to some of the children on the other side, they don't have that kind of experience, or they know someone, but it was more distant. So just the amount of grief that's being carried on both sides is different. How that manifests in mental health issues is significantly different. And will have reverberations, I think, for years. These are not things you get over right away. So I think in terms of mental health, we also know that in terms of obesity and weight, that even though we were seeing plateaus and things starting to get a little healthier because of policy changes, that obesity rates have gone up during COVID on both sides of the track, but more on the low income side.
The refrigerator is 20 feet away instead of...
And I may want to say not just in kids. I think we can all maybe be a little honest about that and say we're all working, right, to struggle. And what a great lesson for all of us, that context matters.
Yeah.
Like, you can't just look at someone and say, get it together. You should know better. It's not a question of knowledge, right? It's a question of setting. And
they're very deep brain circuits that are very hard to control.
And I think it's good and humbling to remember that it affects us too, right? Yeah. Like, we're all doing it. Okay, so let's switch then from health to from health and mental health impacts to educational impacts. Oh my gosh, this distance learning thing that happened, right? That had to get stood up overnight, that we're suddenly going to shift, and yay for us and our country for being able to pivot significantly. Lots of parts of the world were not able to, but in the United States, we did stand up online curricula and move to a distance learning model. What it did was really shine a light on how critical a part of our infrastructure is, and that is broadband. And digital access is not evenly distributed. And this is something that we had talked about years ago. People talked about
the digital divide, I remember.
Do you remember the digital divide? Yeah, one of my very first things that I got involved with was a computer club in East Palo Alto, and the kids named it the Hookup. Right. And I was like, because we let the kids name it, and we were like, the Hookup, seriously. Okay, we called it the East Palo Alto Hookup, and because they could come and print their homework at this church. Right. Anyway, so that was years ago, and we talked a lot about the digital divide, and then it kind of fell into the background noise, and I think many of us erroneously assumed that was maybe not as much of a problem.
It seemed like cell phones were taking over, and everybody had a cell phone, so we're all okay. But then when you're at home and you need a big screen and you need to look at your teacher for 4 hours, the cell phone is not going to do it.
Yes, exactly. And so when you've got, multiple family members in these homes trying to share one Wi-Fi, circuit, and maybe don't have the most up-to-date devices that have all the most recent software so that they can Zoom and have uninterrupted streaming. This just became clear that we did not have equal access. And so many of the schools, and we were involved with this here in my program, getting helping get Chromebooks out to everyone, get people set up, and just this idea that just like the telephone or electricity things in the past, that we really need to start thinking about broadband and digital access as one of the components that everyone needs to have equal access to in order to thrive in our culture.
That for me is one of the most important messages of what you're saying, is that I'm hearing a pediatrician tell me how important broadband is as a matter of health, and that is not a direct line, or wasn't a direct line until very recently, where now it's not that hard to see why there's a health implication to not having good internet access.
Absolutely. I mean, your educational level ends up helping to determine, it really is the primary influencer of health as opposed to a social determinant of health. We like to think of it as an influencer. It's not determining, but it deeply influences your ability for the job that you're ultimately going to get, the zip code you're ultimately going to live in, the schools your children will eventually go to, right? So it's such a pivotal part of your ultimate health and your life expectancy, frankly. So, so we've been advocating hard for, some of the broadband changes and equal access to devices and Wi-Fi. So anyway, so I would say education. So some of the learning loss, people are starting to quantify it. It looks like in our lower income communities, it was over the year and 3/4 that people were online there. About 5 months of math and 4 months of literature learning, literacy.
The equivalent learning was lost.
Yep.
This is The Future of Everything with Russ Altman. More with Lisa Chamberlain next on SiriusXM Business Radio, Channel 132. Welcome back to The Future of Everything. I'm Russ Altman, and I'm speaking with Professor Lisa Chamberlain from Stanford University. In the last segment, we were discussing all the ways COVID has impacted the health of children. Next, I want to ask Lisa about the increasing use of telehealth, that is, seeing your doctor over the internet. Lisa will tell me that pediatricians have seen some amazing benefits of telehealth, and it can act in many ways as an equalizer of health opportunity. However, access to a good internet is key.
Great question. Oh, it's been such a pivot. It's been really exciting. Overwhelming at first. We were all struggling, like, how does this work? And the glitchiness of it. But it's really settling out into bringing some really powerful things. So what I would say is one of the first things that we all reflect on, it's kind of like a modern house call. So remember how the old time doctors used to make house calls, right? And even in medical school, you probably remember like how much doctors would say they would learn in that setting. When you see the house, you just go, oh, this is a new thing. Okay, well, now we're zooming into these homes and we're seeing a context that we didn't used to see. And one of the things that's so cool about pediatrics is that the child lives within this context and really, like thrives or not based on it. And so being able to see that, see whether the quiet or the chaos, the crowdedness or the not, just the whole thing, you get a whole new appreciation.
That's fascinating. So that means that you really don't want them to just have a white wall in the background. No. You would much prefer a little bit of a background scene to find out what's going on.
No, and I love it because you can hear all the... Anyway, so some families I've known for a long time, when we're suddenly doing these telehealth things, I'm getting all new appreciation. So right. I think there's a powerful opportunity to understand context. I think in terms of making health disparities worse or better, and by disparities I mean differences between in health outcomes between different groups of people. I think of kind of two groups: our children with medical complexity, so our kids with congenital heart disease, cancer, things like this. I do a lot of research looking at these groups and use big population data sets to look at it. I think it has some incredible opportunities to reduce disparities. So some of the disparity drivers are things like it's hard to get to Stanford. It's hard. I live really far away. I can't take time off of work because if I do, I'm going to be fired. You don't speak my language super well. And so I struggle when I try to talk to you all in person. So all of these issues around really having good access. We have different kinds of challenges. Now, when you zoom in, you can overcome a lot of those barriers. You don't have to take a whole day off of work. We automatically can bring a translator right onto the screen for us. And so there's a lot of things that I think can reduce disparities. So I think, and particularly for those children with complexity, I think this is critical because access to them is critical.
So I never would have guessed that, but now that you say it, it's obvious that, follow-up appointments with a kid with cancer, that, mom and dad both have jobs, and now you can just say, I just need a Zoom for 15, 20, whatever minutes, and you can do that critical follow-up and say, you really need to come in, or you're doing well, see you in a month.
Exactly. And so even those first couple of weeks of the pandemic, when that access was critical, that's pivotal for those families that are in those, chemotherapy protocols and stuff. I mean, those were really tenuous times. So that's the children with complexity. I think there's great promise. But again, that means we have to have equal access.
Broadband.
If we don't have equal broadband, right, one group of kids is going to be able to take advantage of telehealth and one isn't. So with the unintended consequences of technological innovation, it really pivots on access.
Okay.
And I really feel like a lot of people who are in love with technology, you really have to think that through. Like, is unequal access going to generate disparities?
Right.
If the Apple Watch helps, then everyone needs one, because if you only give it to the rich people for their arrhythmias, you're going to generate more disparities. And I know you didn't mean to do that, but you're going to. Right. So really thinking about access for interventions that work, you have to ensure access or you're going to have this unintended consequence. The other thing I'll say for telehealth is the opportunities there is with mental health, because this young generation and mental health is difficult to access. Even if you have great insurance, it's hard to find good counselors and people you can reach and talk to. But the adolescents, I find, will say anything into their telephone. They will they will bare their souls in a way that, like, I'm like, as an adult, I think I'd rather be in a room. But they don't.
A lot of sharing.
A lot oversharing, we could maybe suggest, but no. So I think that there's great opportunities with telehealth and mental health. That like you were saying with the dermatologist, there are some subspecialties that really lend themselves to telehealth, and I
Yeah.
would say that psychiatry and psychotherapy and counseling is one of these areas.
So that's fascinating because it's not just getting to a good level that you would have had if you were in person. It seems to me that you're suggesting that the level of ability to talk and with a counselor or a psychiatrist or a psychologist might be better online.
It's really interesting, isn't it? Yeah, and we know that like when adolescents fill out surveys, they're more honest on an online survey than a printed one, where they use a pen
Yes.
and pencil. So there's something about the tool that you're using to get the information that there is a more candor. So it's not only just that they feel more comfortable talking, but that again you overcome those barriers of driving, parking, accessing it, etc., having the right language.
So this is very exciting. So in our last 3-ish minutes,
Yeah.
I know you've thought about the pediatric office of the future,
Yes.
and so can you paint a picture? What are our children or grandchildren going to experience as patients in the future? And I'd also love your sense about whether this is a utopian view or really within reach. And I know that you're a real person in the sense that you deal with the realities. So I'm really looking forward to this because I don't think it's going to be utopian.
Yes. So I see the Pediatric Office of the Future, I think, has a great opportunity to be an equalizer. I think it can play a role in helping to equalize opportunity for all kids. The pediatric office is the one place where 100% of the kids come through. So nearly 100% of the kids are born, for the 0 to 5-year-olds, are born in the hospital, and they almost all go to school in kindergarten in some form. But 0 to 5, we have a very fragmented system. Where they do come through is the pediatrician's office and the health sector. And so I think we could really transform this space through texting interventions with parents, through different kinds of modalities, coaching, telehealth, more connectivity, more frequent communication, team-based care, where we could really put our arms around families in a much more significant way. Some of my work in the last few years has been around texting interventions. I love the idea. Parents love it. They love getting texts from us. So instead of hearing from me just once every 3 or 6 months, three times a week, I'm sending you some ideas of how to promote the development of your child. We've seen huge gains in the kids in these randomized trials that get these texts. The families really love them. Very few disenroll. So I love the idea of in the future, I can kind of have a drop-down field of texts and say, what would you like me to talk to you about? Do you want to talk about math development, math, early literacy, social emotional development, how to handle temper tantrums? And I could just pick from this, drop-down field of the different texts these families can get that are evidence-based text platforms, and suites of text that they could get. So that's one thing. So how we could really treat our 0 to 5 population in a really different way. And then
it also strikes me that the parents will increasingly be these digital natives that you talked about. So they're going to even be more effective at communicating and making decisions because they're going to be the young women will be now are the mothers of the future.
Absolutely. Yeah. And then more telehealth in there.
So this is a very exciting, and I wanted to ask about the young mothers, and I also wanted to ask, is this going to happen? So do we have the societal will in the last 30 seconds? What needs to happen on the policy level to bring this great reality to fruition?
On the policy level, we need to break down a couple big silos. So hold both the health sector and the early childhood sector accountable to different outcomes that they can share. So there's some data sharing opportunities there that I think are huge. And it's not a question of technological capacity. It's a question of political courage to say we're going to link a lot of this data and move forward in this way. And then the second piece would be Medicaid reform. How do we pay for some of this and doing kind of bundled payments and some alternative payment methods, APMs, things that are definitely in conversation, but are slow to seem to happen. So on the upside, kids aren't as expensive as a lot of the other populations. So I think a lot of this can be done not being a huge price tag at all in the big picture. So I'm very hopeful that we can be more innovative when it comes to kids and their healthcare.
Thanks to Lisa Chamberlain. That was the future of pediatric health. You have been listening to The Future of Everything with Russ Altman on SiriusXM Business Radio, Channel 132.